When people in the Rio Grande Valley think of serious health issues in our communities, the first thought is diabetes, maybe heart disease. However, women have been fighting a secret battle many do not like to discuss, one that is taking the lives of mothers and daughters every day.
One of the PAs calls me, tells me, Yesenia, there's something wrong in your pathology report. You know, we see that you have clear cell carcinoma. And she told me, but are you okay? Do you know what that means? I'm like, yes, I have cancer.
Leading up to that point, life was normal for Yesenia Garza, a 25-year-old college student. She had no family history of cancer, but had now been diagnosed with the disease.
I was just in shock. The first thing that comes to your mind, I'm gonna die. I'm not gonna make it. I never thought that I would be the one having cervical cancer. You never think that it's going to happen to you.
According to the American Cancer Society, over 12,000 women are diagnosed with cervical cancer each year, with 5,000 dying within a year of detection.
I think no women should die from cervical cancer in this decade.
Dr. Ana Rodriguez tells us many women in the valley never get diagnosed due to the high poverty level, which stops people from visiting their doctor for a checkup. The last census in 2014 shows all 4 counties that make up the RGV have over 30% of the population that live at or below the poverty rate.
These women are very cultural sensitive. They don't speak the language. They don't know the system. They are new in this area. So there are so many barriers that go along with this problem.
Doctors and researchers from MD Anderson, Rice University, and the University of Texas Medical Branch are visiting the valley and have brought along the latest iteration of cervical cancer detection technology, the high-resolution microendoscope, or HRME.
This machine, you just put a small little probe on top of the cervix, doesn't hurt, or the patient really doesn't even feel it. It takes an image, and within 5 seconds, it tells you whether or not the cells that it's looking at are either normal or at high risk of being either precancer or cancer.
The HRME has been in the works for over a decade and has gone through several upgrades. This machine allows testing right away instead of waiting to send off tissue samples that could not only delay detection, but life-saving treatment. This machine could drastically cut down the cost of testing as well.
And then, is she eligible, yes or no? And you should know that before you see the patient.
The team has gathered here at the University of Texas Medical Branch Cancer Center in McAllen to talk with patients about the cutting-edge technology and offer them a chance to be part of the study.
I know Jessica spoke with you about the study. Thank you for agreeing to participate. The cervical cancer rates are about 30% higher here along the Texas-Mexico border compared with the rest of the state. And it's not so much that there's been a big rise in them, there just has never been a decrease.
Kathleen M. Schmaler, an MD Associate Professor of Gynecologic Oncology and Reproductive Medicine, has been with MD Anderson since 2008. In that time, Dr. Schmaler has worked to achieve cervical cancer prevention and treatment. Today, Dr. Schmaler is training with each of the researchers.
We're working to train local providers to provide these services with colposcopy and LEAP in order to treat women before it becomes invasive cancer.
This has been a month for us. It's been very difficult. We've diagnosed 9 breast cancers and 3 cervical cancers and 1 endometrial cancer. And it's just as hard as it was the one before.
I would just say, you know, get tested. It doesn't matter what age you are. This happens to everyone.
Yesenia underwent radiation therapy and surgery in Galveston with the entire clinic and her doctor by her side.
I remember she was holding my hand on the day of my surgery, and she told me, don't worry, everything's gonna be okay. I promise you everything's gonna be okay. You're gonna be okay. I felt very confident. I knew it. I was in good hands. Like, I just felt it. I was in good hands.
Ana is now cancer-free with just a few more checkups to confirm her new status. And while she may have beat cancer, many in the RGV still lack the access to life-saving treatments.
So hopefully the promotion of the clinic, and as far as what we're able to service through this research, will help those women and ultimately prevent a cervical cancer.
It's great to be able to work on something and actually seeing it being used and being a useful tool in the clinic.
Hopefully one day we won't need to do colposcopy and cervical biopsies, but instead be able to use this device that was developed by Rice University.
All in hopes of allowing any woman to plan their future, even if it's a wedding.
I was shaking. And he's just like, "Would you marry me?" I'm like, "Yes, of course." And I got engaged. Oh my God, I was so excited.
While we were at UTMB, 2 women signed up for the program. The results of the HRME will be taken to Houston to be examined and tested. The program continues now at UTMB with more patients signing up daily.